Hi guys, and welcome back to the Pretty Healthy Podcast. I am your host, Dr. Brandi Moore, and today we're going to be talking about stress and hormones. So we're going to get into a little bit about what I mean when I say hormones, because I feel like it means way more than people think it does. We're going to talk about acute versus chronic stress and how our bodies handle it and how they're meant to handle it. Also going to get into some symptoms you might notice if you have chronic stress or acute stress. And then we're also going to talk about some of the ways that you can manage your stress that have been proven with research backing them. So really excited about today's topic because I feel like it affects more people than we realize, especially in the last year. A lot of people have been affected by stress and are seeing some of the effects of it, but maybe don't know that it's related to stress's effect on their hormones specifically. So that's what we're going to get into today. If you did not know, I do record these episodes and post them on YouTube. So you can find the video if you would like to watch the video at youtube.com at Dr. Brandi Moore. Also, if you're watching on YouTube, please if you like the video, subscribe, comment, interact with me. That's the best way to get these episodes seen on there. And then if you're listening on Apple or Spotify or any of the other podcast listening platforms, then please feel free to rate and review the episode. Again, that is how we can get the podcast itself in front of more eyes and so that more people know about it and are able to learn and grow with us as a community. So let's get right into today's topic. So like I said, we're going to be talking about stress and hormones. Hormones is a kind of general term that's used. And when I say hormones, what I mean are your adrenal hormones, like the ones that respond to stress, like cortisol, your female or male hormones, which are called the sex steroid hormones, and then thyroid hormones, I would say are kind of the trifecta when we talk about hormones and hormone balance. Those hormones can literally control everything from the hair on your head to the extra 5 pounds that you're trying to lose to the energy you're trying to figure out where it went after it disappeared. Like all of those things can be very much explained by, I'll say, imbalances in those hormones that I mentioned, the hormone categories. So when we talk about stress, what is meant to happen, evolutionarily speaking, is you see a bear, and you might have heard me give this example before, but you see a bear, you are, instantly shocked. Fight or flight kicks in, you get increased circulation, digestion stops, things like that. You are meant to run from that bear, get to safety, and then get out of that acute stress response. Right? There's even some animals in nature that shake off their stress. So they might have a really stressful situation. And then right after, you kind of see them like shaking to get kind of the stress off of them. There's only very few animals that don't do that. We happen to be one of them. And then also rabbits, from what I heard. So it's very interesting, but that's meant to be your acute stress response. You see that, you run or sprint, I guess. And then when that danger, that threat is done, you are meant to go back into a non-stress state. So what do I mean when I say non-stress state? There's two states that you can have, parasympathetic and sympathetic. Parasympathetic is our rest and digest. This is where we're meant to be most of the time. Sympathetic is that fight or flight response. And so we often will be stuck in a sympathetic state, which will cause things like abnormal digestion, right? I just said rest and digest. It'll cause some other adverse reactions that we'll get into. But what you want is to kind of switch off the sympathetic and be in the parasympathetic, which is the same acute versus chronic stress response I'm talking about right now, to kind of loop those in. Chronic stress looks like you are constantly running from that bear, right? So it might have been 5, 6, 10 years of running from a bear. The adrenal glands, when they release cortisol, are meant to do it in those short little bursts, right? Like I said, see that bear, run, you're out of danger, you can calm down. But what happens with chronic stress is that you're running, adrenals get tired and they're like, hey, friend, love you, but we're kind of tired, so we're gonna take this break and you can figure it out on your own. When that happens, you get a shift in the rest of your hormones. So when the adrenals stop managing your stress or responding to your stress effectively, you then get a shift in your sex hormones and you get a shift in your thyroid and how it's performing. So it is really, really imperative when we talk about managing stress that you have an understanding that stress literally does affect everything else. Stress can cause things like anxiety. Stress can cause things like hypertension. So stress really is a lot bigger than the feeling you get when you feel like overwhelmed, which is something else I'll tap on really quickly, is how you recognize stress. So some people recognize stress as like anxiety, and that's when they know they're stressed. Some people recognize stress as just like this feeling of overwhelm, where it's not full anxiety, not panic attack, but they just feel like their plate is full. But not everyone recognizes when they're in the middle of kind of a chronic stress. They'll say like, oh, things are fine, but they'll describe to me that they are stressed. They'll describe all the things they have going on, they're feeling towards them. But then when I say, rate your stress on a scale of 1 to 10, often it's like, well, I'm not really stressed. I live a pretty stress-free life. Everyone has their stuff, but so if that's you, if that's the answer you would have given me, you're probably more stressed than you realize. So what happens is we take this kind of acute versus chronic presentation, use that as information to know that we need to switch out of the chronic stress state. And the reason why is it affects every aspect of your life. So some of the symptoms that you might notice if you are in a chronic stress situation is weight gain, difficulty sleeping, fatigue, so you're tired all the time. You might also be irritable. You might also notice that you get sick very frequently. You're that person that's always fighting a cold or always fighting a flu or always kind of fighting something. That can be directly related to chronic stress. So from a hormone perspective, some of those symptoms that you'll realize from chronic stress would be fertility issues, irregular periods, as well as weight gain, fatigue. So there is some overlap there, and decreased libido. So how does stress directly affect our hormones, right? We talked about how the adrenals are meant to respond to stress. To recap, see that bear, release cortisol, run from that bear, right? That acute sympathetic state. But how does it affect our hormones if we're in a chronic state of stress? Well, I'm going to be specifically talking about female hormones and how stress affects that. So when it comes to that, what happens is as your cortisol is high, or we'll say that you have a higher need for more cortisol, which again is that hormone that's released to help us manage stress. Your body will take progesterone, which is a female sex hormone that you need for reproduction, and it will actually shunt it to cortisol to support that stress pathway is what I'll call it. So with more support to that stress pathway, we're not giving into this sex hormone fertility pathway that we're meant to be giving into. And so you'll see a couple of different things. You might notice symptoms of estrogen dominance, which again is that like headaches, mood swings. You might notice some anxiety or depression. You can also notice things like weight gain or bloating. That's all a lot of estrogen dominant symptoms. The reason why is because if progesterone is low, even if estrogen is normal, it will present as estrogen dominance. So you really want to keep these hormones in balance to prevent side effects, or I guess not side effects, this is not a medication, but to prevent the effects of having that imbalance. Another thing is that same process that I just explained will also tax the thyroid. So the thyroid is a gland located kind of at the middle of your neck. And what that gland is responsible for is things like your metabolism, your energy. You can notice mood changes if it's off. And so we're really muddying the picture here. The more I speak of some of those symptoms, I'm sure you're noticing that there's a lot of overlap, that when hormones are off, a lot of the symptoms are the same. Which is why it's great to have a doctor on board with you to test things like your hormones, who has an understanding of what those optimal ranges are and can easily pick out, okay, no, based on the symptoms that you're saying, plus your labs, it's looking like it's more estrogen, progesterone, hormonal imbalance than thyroid imbalance, because a lot of it can look very similar. And so, yes, you need someone who knows what they're doing, who kind of parse out what organ or organ system might be the one that needs a little bit of tweaking. But all in all of this boils down to the fact that you are stressed and you have to deal with said stress. And if you don't deal with said stress, then it's going to make everything else worse. Okay, so we've talked about some common symptoms of acute versus chronic stress. We've also talked about kind of when I say hormones, what exactly I mean, and the role that stress can play on the hormones. So now we're going to talk a little bit about how you can manage your stress. And there's some proven ways, there's research backing it. In this podcast, I will be mentioning the journals and the year that they were published. If you would like to read the studies yourself, please feel free to click the link in the show notes. It'll direct you directly to the research articles that I'm referencing. So the first way that it's a really great, effective way to lower stress is to do breathing exercises. So this is something that I recommend quite often. Most of the time, I'll balance between meditation and breathing exercises. Honestly, I tailor it to my patients. So I kind of gauge their willingness to do something like meditation, which we'll talk about in a second, and their openness to it. If they've tried it before, if they've liked it, and if they kind of give any resistance, then oftentimes I'll recommend breathing exercises. So the most common breathing exercise I use is called the 4-square breathing technique. So you just inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, hold for 4 seconds. And so you kind of repeat this cycle at least 3 to 4 times. And the idea behind the breath is that you're switching from that sympathetic state, right? The fight or flight chronic stress response, to the parasympathetic state, which is where we're supposed to live most of the time. So you're switching that off. The study that I'm referencing, I'm just looking down at it really quickly. So there was a study that was done in 2017 by the Frontiers in Psychology. And the title of it is The Effect of Diaphragmatic Breathing on Attention, Negative Effect, and Stress in Healthy Adults. And basically what the research showed is that breathing exercises lower the physiological stress response. And that means that it can directly decrease things like cortisol. So to back it up, because I know this can be a little bit complex of a topic, our adrenals release cortisol to help us manage stress. In an acute stress situation, we release that cortisol, run from that bear, calm down, and then everything goes back to baseline, goes back to normal. In a chronic stress state, we release the cortisol from the adrenals, but we're chronically stressed. So we're just kind of always pumping out the cortisol. We're always in this fight or flight state. We're always in a sympathetic state. So what breathing can do is switch you from that sympathetic to that parasympathetic. It can calm that physiological stress response. So specifically, whenever you do breathing, and I want you to do this with me right now, because you need to learn how to breathe. And I know you're probably thinking that sounds really silly, but most of us don't breathe properly. If you have kids or you're around kids, whether they be nieces or nephews or cousins or whatever, I want you to watch them breathe. And most of them belly breathe. So the belly rises and the belly falls. The belly rises and the belly falls. We tend to learn how to kind of turn off our natural breathing technique as we age. And we develop more of a chest breathing. So if you watch an adult breathe, they're going to breathe from their chest. Actually, I want you to, while you're listening right now, take your hand, well, if you're not driving, take your hand, put it on your chest and breathe a couple times. And you'll notice that you notice it in your chest. Now, I want you to take your other hand again, if you're not driving, and put it on your abdomen. If you're watching this on YouTube, you can see exactly where I'm placing my hands. If you're not, I'm placing my right hand on my chest, right kind of on my breastbone. And then my left hand is right kind of, I would say at the base of your ribs, kind of where you assume your stomach is, which is actually where it is, but most people don't know that. So, so what you're going to do is I want you to take a deep breath in through your nose, out through your mouth. In through your nose and out through your mouth. Now, we didn't do the holds there, but the whole point of that exercise was for you to recognize where you naturally put your breath. And most of us, it's up here in the chest. So now what I want you to do is to really focus on when you take a deep breath in, expanding the stomach. So what happens when you breathe in, you have something called a diaphragm. Again, if you're watching on YouTube, watch my poor hand demonstration. But basically your diaphragm will lower to allow the lungs to expand, and then it goes back up. So it lowers, the diaphragm is at the base of the lungs. It lowers as you breathe in so the lungs can expand. And then as you exhale, it goes back. That is diaphragmatic breathing. This is the type of breathing that was done in the study, which is why I'm taking the time to kind of explain it to you. Another way to see if you're doing diaphragmatic breathing is to lay on your back, do the same thing that I just showed you with your hands, one on your chest, one on your stomach, and make sure that when you're taking that big inhale, it's happening on the hand that's on the stomach and not the hand that's on the chest. You can teach yourself how to breathe correctly. And for things like what I'm talking about when it comes to having that physiological response where it effectively lowers the stress response, you do have to breathe appropriately. So way number one to lower your stress, diaphragmatic breathing. Again, I'll link all of the studies that I talk about in the show notes if you're interested in checking them out yourself. Okay. The second thing that's really effective for stress is meditation. Now, I know I'm not the first one to tell you this. You've probably heard this a lot, but have you done it? Now, I'm not asking you to raise your hand because I don't want to embarrass you in front of the class, but 9 times out of 10, you probably have, but not consistently. And a lot of us struggle with meditation because, again, in the world we live in, it's very, very, very hard to shut off our brains. You might be the person that lays down to go to sleep at night, and the minute your eyes close, no matter how tired you are, your brain is pink on. It wants to tell you about your day, that all the tasks you have to do the next day, all the things you forgot to do today, all running through your mind at top warp speed. And it's very hard to shut it down. Things like meditating can help you shut it down, which is why it's so important. What I describe too is that classic adrenal fatigue picture, wired and tired, meaning I am so awake mentally that I can't go to sleep even though I'm physically exhausted. It also looks at you can get through the day pretty well, and then you go to bed at night and your brain is pink again on talking to you the whole time, and it's really hard for you to shut it down. So this is where things like meditation can come in and really shine when it comes to helping out with sleep and stress. We'll get into sleep and stress in a second too, so remind me. But when it comes to meditation, there are plenty of studies that have been done on it. One that I'm going to bring up today for you guys is mindfulness meditation and the physiological markers of stress. This was published in 2017 in the Journal of Psychiatric Research. And what it talks about is how mindfulness meditation specifically decreases that physiological stress response, which is what we talked about, right? Adrenal glands releasing cortisol in response to stress. Again, in an acute situation, that's awesome. In a chronic situation, it can cause a lot of health issues. So mindfulness meditation, so many people struggle with meditation. I really like guided meditation is my number one recommendation for anyone who hasn't meditated before or who has a really hard time shutting off their brain when they meditate. There's something about listening to someone else give instructions and prompts that can really allow you that to focus on. So for instance, every time your mind starts to wander, it can be brought right back with someone then telling you, okay, are you focusing on this? Are you focusing on the breath? Did you lower the shoulders? I want you to unclench the jaw. All of those things can be really helpful. They can also help you see what it's supposed to feel like when you meditate, so that if you go and do it on your own, say more of like silent meditation and not obviously guided where someone's guiding you through it, you have a better idea of what it's supposed to feel like. Another thing that's a kind of a tip when it comes to meditation is oftentimes we think if we're thinking we're doing it wrong, and that's just not true. So what's meant to happen during meditation is that you have a wandering thought and you're supposed to let the thought pass through you. If the thought's not passing through you or it's starting to kind of nag at you, we tend to think we're doing it wrong and we're just not meant for meditation. It's just not for us. But really what's happening is it's like working out. The first time you do a bicep curl, it's not natural. It's not something you normally do in everyday life. No one just walks around bicep curling. Now, you might do it inadvertently without knowing, right? Picking up children is basically a bicep curl, picking up your dog. So there are things that we do that mimic that motion without being a proper bicep curl, but it's going to feel awkward, uncomfortable the first time you do it. And you definitely don't start with heavy weights. Meditation is very similar. So often I recommend starting for a short amount of time. So like 5 minutes. Don't go sitting doing an hour worth of meditation if you're brand new. It's just really hard. But when it comes to meditation, every time your brain wanders, think of it as a bicep curl. So brain starts to wander. Okay, I'm going to take that thought. I'm going to grab it. And I'm going to bring it right back to what I'm supposed to be focusing on, the present moment. Oh, had another thought. Okay, I'm going to take that thought. I'm going to bring it right back to the present moment. And what you're doing is your brain is like a muscle. And so you're just strengthening that muscle to where you're going to get to a point where the time it's going to take you to grab that wandering thought and bring it right back is going to be seconds. That is the goal with meditation. So if you try it and you notice that your brain's wandering and you're having a really hard time, know that's part of the process. Know that you're practicing and that you will get better with more practice. But research has shown that it does decrease the stress response. So if you're someone who's dealing with chronic stress, whether it be a high-powered job, whether that be just managing a household with kids, whether that be being an entrepreneur or going through a graduate program, all of those things are very stressful. And what you don't want is to have issues. I feel like I've mentioned this before in other episodes, but the body will compensate until it can't anymore. You will get where you can make it. And then your body's going to shut down and be like, I'm done. Like I can only do so much. And then you'll really have to grab some of these tools. So my perspective is always preventative, right? Let's prevent the worst case scenario from happening. And let's work on that stress response now so that when that super stressful time comes, you have something that you can hold on to and that you can use. At the end of this too, I'll share my personal story with stress and kind of the life lesson that I learned why, again, if you don't slow down, the body will slow you down. So, okay, tip number 3 for dealing with stress is exercise. This is one of my favorites, but it's also a double-edged sword. So your body doesn't always recognize good stress versus bad stress. Stress is stress. So if you're living a very stressful life, then I do not recommend doing high-intensity training more than twice a week. Love a good weight session, like weight training session, Pilates, bar, yoga, cycling, all can be really great. But that high intensity, long time interval training can tax the adrenal glands. So there was a study that I found that was published in 2008 by the Journal of Endocrinological Investigators. And it was exercise and circulating cortisol level. And really what they did was they tested healthy males, 3 different groups, and they measured the VO2 max, which is just how much oxygen was used during an exercise. And so they did, 40, 60, and 80. And what they found was that if they got up to the 80 VO2 max, like they were working their hardest, that they noticed that the cortisol levels in the blood increased, meaning it increased the stress response, even though they were doing something good for them. So if you're in that chronic stress state already, your body still recognizes that as cortisol, right? It's not like, oh, hey, hi, I'm cortisol from your stressful job. Oh no, hi, nice to meet you. I'm cortisol from your stressful workout. It's just all cortisol, right? So you really have to be mindful that that stress response will spike cortisol levels. And so you need to be adjusting your exercise to that. If you're in a stressed out time, say you don't know your cortisol levels, but you're in a stressful time of your life, then I would, again, manage that twice a week, high intensity training, and then the other days supplementing movement with low intensity exercises. This is probably a good point where I'll share my personal story. So there's been quite a few times where I've been stressed out in my life, to say the least. One that really sticks out to me, there's 2. One shows how stress can affect your hormones, and one shows how stress will catch up with you. So when I was in residency, which obviously most people know is stressful. I was also planning a wedding at the same time, which again, very exciting. Both things are exciting, but they're also very stressful. And I wanted to start exercising again because I had exercise, but I wasn't doing an exact program. And so I joined a high intensity gym and started doing high intensity interval training like 4 to 5 times a week. Felt great. I loved it during the actual workouts. It was great feeling, all the endorphins released. It was wonderful. The issue came the closer I got to about the 6-month mark of doing this, of again, having a stressful job, a stressful life, home life, I guess. I mean, our life at home was great, but planning a wedding again is stressful, coordinating all those people and all of the venues and things. And doing the high intensity interval training, I noticed that my cycle started to get closer and closer together. Now, if you haven't listened to any of my stuff on how to track a cycle before, day 1 is the first day of bleeding to day 1, the first day of bleeding. So if you have a provider ask you your last LMP or your last menstrual period, they want day 1 of your last cycle. You count the number of days until you hit day 1 of the next cycle, and that is your cycle length. So on average, that's about 28 days. And what I was noticing is that my 28 days was going to 27 to 26 to 25 down to 24 and started being consistently in that 25, 24 range, which is too low. It basically says that my progesterone has lowered. And so I'm not able to maintain the second half of my cycle like I'm meant to. And did blood work, and sure enough, my progesterone had started to decrease. And this was directly related to the response that I said earlier. If your adrenals are stressed and they need cortisol, they will take it from your progesterone. So your progesterone is no longer acting as that sex hormone, supporting that pathway. It starts to support the stress pathway. So I learned really quick that that probably wasn't a good go, but obviously, like most people, I have to be taught many times to learn a lesson. So the second time in my recent life that I noticed how stress can really affect our body is I was 9 months pregnant. We were in the middle of buying and selling a house. And again, all exciting things, right? Babies are exciting. I was, had finished residency and was figuring out my path as a naturopathic doctor where I was practicing, which again, good, but stressful. And all of this stuff, I wasn't talking about what was going on. I wasn't having a dialogue or a conversation with anyone. I was stressed out, but didn't want to stress out anyone else around me, which I feel like is the story of a lot of women. And so I just held it to myself. I kept it very close to the chest, and I got shingles at 9 months pregnant. Yep. So it was very painful if you've ever had shingles, and it wasn't pleasant at all. And I realized that stress played the main role. Now, I mentioned something about stress earlier that I'm going to bring up now because in my life example, I hope that it really sticks with you. Stress lowers your immune function. So earlier I mentioned that stress can make you more susceptible to frequent illness, and that is why. Stress, aka cortisol, lowers your stress response, so it makes you more susceptible. Now, you have certain pathogens like the herpes virus, which chickenpox is a herpes virus. I'm not talking about like genital herpes, but chickenpox, when you get exposed to it as a kid, that virus stays with you. It doesn't go anywhere. It lives with you. When you get older, which is when you typically see people that have shingles, their immune system lowers. They might also have a stressful event and then shingles pop up. So it's very true, this idea that later on down the line, cortisol or living in a chronic stress state can have effects that you're not expecting. I was not expecting to get shingles at 9 months pregnant. If any of you ladies have been 9 months pregnant in Arizona summer, I want to sit for a second and I want you to feel for me. I was in the middle of 112, 113, 114 degree weather, still going to work because it's not contagious. So where I had it, it can be contagious. That's why I took that pause. Where I had it, no one was getting in contact with it. So it wasn't a danger in that way. And I wasn't obviously with patients, you're taking proper sanitary precautions and washing hands and disinfecting and things like that. So if you didn't know, shingles comes on a dermatome. Mine happened to be mostly on my back. So it was back there again. No one was touching it. I wasn't around anyone. So it wasn't a danger in that way, but I was still going to work and having to wear a bra, and it was right on my bra strap line. It just was not pleasant. And I learned a lot from that situation. What I learned is don't hold it in. Don't hold your feelings in, which brings me to ways to lower your stress. Idea number 4, and that is journaling. Journaling can be a powerful tool in regards to lowering stress. If I had taken the time to journal when I was in one of my most stressful moments, pregnant, moving, selling a house, switching jobs, all of that stuff, if I had taken the time to journal, I don't know that I would have broken out in shingles, because I would have had a way to express those feelings, to write them down, to think about it. And I find that oftentimes when we're in those situations, we look out, right? You're looking out at everyone. Like, what's your advice? What's your advice? How can you help me? What do you have to say? I'm watching this video on how to lower my stress, or that video on how to lower my stress, or how to deal with my situation, instead of looking in and saying, okay, how do I feel right now? Okay, I'm sad. Okay, that's fine. Why are you sad? How can we work through this sadness? Is this something we need to talk to someone else about? Is it past the point of no return? We need therapy. Like, using self-reflection as the first step can really alleviate a lot of things that we normally go outward for. So I recommend you going inward. I definitely recommend journaling. Again, I feel like if I had had a stress relieving practice such as journaling at the time that this all happened, I would have had a very different outcome, and I would have been able to communicate my feelings a lot more, because I would have sat with them and thought about them and clarified them and seen where the issue was, enough to effectively communicate them to my partner and say, hey, this is how I'm feeling. This is what's going on. Like, I just need XYZ from you. But I didn't take the time to do that. I just ignored it until I couldn't ignore it anymore, because it was there. It was on my body. I wasn't doing anything about it. So to recap, the 4 ways that you can lower stress: breathing exercises, meditation, exercise, and journaling. So these are just some of the basics. There are plenty of other ways, whether that be adult journaling or puzzles, but I really do encourage you to find ways that work for you to relieve your stress, because again, it can wreak havoc on every area of our life. And I hope that you learn from me and my mistakes, and that you don't have to get shingles like I did to learn this beautiful lesson. And you don't have to affect your hormones, which is also something that I've done to realize the lesson that stress can play on a lot of our life, especially our hormones. If you enjoyed today's episode, please like it on YouTube, subscribe, leave a comment. If you're watching this on Apple Podcasts or Spotify, I really do appreciate a rate and review. It really just helps the episodes and the podcast be seen by other people. Also, share the episodes. If there's anyone that you think is stressed out and could really benefit from this material, please send it their way. I really would appreciate it. And yeah, thanks so much for tuning in to this week's episode. I will see you next Tuesday. Bye, guys.